So today we're going to talk about leg pain, and that's a pretty common problem that people will come in with. Most of the people that come in with it will say that they have sciatica, but not all leg pain is sciatica. But certainly if you've had sciatica, it's leg pain. Come right over here. Okay, so sciatica is actually an inflammation of the sciatic nerve. And the sciatic nerve is this one. It comes down the leg, but it comes off the lower part of the back, the bottom three lumbars and the top of the pelvis, and runs down the leg like this. It's a pretty common thing. A person can start with pain here. It can move down to here, go away from up here. It can come down to here. It can cause the foot to go numb. It can go back up into the back. It can do anything and all things at any time, and that's the nature of having the inflammation of that big nerve. That nerve is about the size of your thumb. It's huge, and probably that's what gets everybody's attention the quickest. These joints of the spine and move when we bend and lift and twist and all of that. Those mechanics of those parts have to move. If they get locked up, when we try to move, it'll irritate that nerve, and when it's that nerve, it'll go right down the leg, and it'll affect the foot. If these nerves up here get irritated, it'll go down and it'll affect the thigh, or down the side of the thigh, or down just to the knee, but won't go below the knee. But true sciatica will actually go below the knee. If it's further up the spine, it'll go into the groin and go into here, into the front of the leg and down toward the knee. And the knee can get disaligned or misaligned or weakened. You think that it's all coordinated together, but if you use it, then you end up with knee problems. That's actually what happened to Derrick Rose from the Bulls. I've never checked his back, but he had back problems a long time before he had the ankle and the knee problems and ended up tearing it apart. That's pretty common, even if it goes on for a long period of time. That dysfunction can cause the knees to give out and the hips to give out. And of course, they'll go get them replaced, but it's replaced by an artificial part. It's never as good as the one that you've got. It's a lot better than having one that's broke. But sciatica and leg pain is pretty devastating, and it creates a ongoing problem. Sciatica causes pain, and it can cause the leg not to work the way it's supposed to. Symptom. We look for handling the symptom. Everybody does. But the symptom comes because something in the body doesn't work the way it's supposed to. But the fix is to fix the thing that doesn't work the way it's supposed to. And that's what a chiropractor does. That's what I do. And that is that the irritation on the nerve affects the function of the body that causes the symptom. You can treat the symptom, but you won't fix the problem until you get the body to function. And if the thing is coming from a nerve being irritated, it won't get better until you get the mechanics straightened around to the spine. That's what I do. So anyone can be affected by sciatica and leg pain. It can be the housewife that picks up kids out of the bath tub. It can be a factory worker. We have a lot of guys who come and pick up boxes, work in factories, work in stores, do warehouse work. Sciatica usually will start with the strain of the back, misaligning the segments, causing the nerve to get pinched. Farmers who get tractor back and then end up with sciatica.